Welcome to Caregiver Cloud and our course on abuse and neglect offenders. Every healthcare professional is responsible for knowing the signs of abuse and neglect. This course focuses on offenders involved in abuse and neglect. As a care provider, you are required to report suspected abuse or neglect to the proper authorities. Knowledge point number 1. Compared to the general public, an accurate statistic regarding victimization among disabled people is that a person with a disability is 5 times more likely to be a victim of crime. In the United States, 5 million crimes are committed against individuals who have disabilities each year. People who have developmental disabilities are at a much higher risk of being victims of physical, emotional, and sexual abuse when compared to the general population. Knowledge point number 2. The likelihood of a disabled child being abused is 10 times more likely than a child who does not have a disability. Children who have communication disorders are more likely to be physically and sexually abused. 64% of abused children suffer from a disability. Knowledge point number 3. The rate of sexual abuse being reported among the disabled population is 1 in 30. Individuals who have disabilities are 2 to 10 times more likely than non-disabled people to be victims of sexual abuse. Exact statistics are difficult to obtain because victims may not be able to say that they are abused. Only 1 in 30 cases of sexual abuse of disabled persons is reported, while 1 in 5 instances of abuse is reported among the non-disabled population. Knowledge point number 4. The majority of abusers of disabled people are known, trusted individuals. 99% of abusers of disabled people are known and trusted by victims and care providers. 28% of abusers of people who have disabilities are disability service providers. Approximately 16% of abusers are family members. Knowledge point number 5. Typical behaviors and attitudes of abusers include selecting easy targets and viewing their victims as less valuable members of society. Members of society often view people who have disabilities as less intelligent, able, and valuable. Discrimination against people with disabilities is common. This type of discrimination is called ableism. Knowledge point number 6. Prolonged exposure to abuse or neglect may result in permanent brain damage. People who have developmental delays are more likely to be exposed to abuse and neglect. Knowledge point number 7. Regarding abuse and neglect within the family, some non-abusing family members may hide the abuse and blame the victim. Family members cause the majority of neglect, physical abuse, and mental abuse. Non-abusive family members may feel fear and shame. Knowledge point number 8. A caregiver may suspect that a client-patient may be a victim of physical abuse if they have burn marks on their abdomen. Signs of physical abuse include unexplained injuries such as broken bones, burns, marks on the skin, or broken teeth. Bites, bruises, and puncture wounds are sometimes caused by physical abuse. If you witness injuries on a client, report your findings to your supervisor, who will contact Child or Adult Protective Services. Knowledge point number 9. A professional caregiver caring for a client who has been physically abused is likely to observe the client's resistance to being touched and emotional outbursts. Victims who are exposed to physical abuse may practice self-destructive behaviors such as cutting or burning themselves. Abused adolescents may run away or avoid going home. They may be fearful, anxious, or withdrawn. Physical contact is often emotionally uncomfortable for victims of physical abuse. Emotional outbursts and aggression may occur. Knowledge point number 10. Results of physical abuse include emotional injuries and death. Post-traumatic stress disorder, depression, behavioral issues, and personality disorders may develop as a result of physical abuse. Abuse injuries to the body may be severe. Permanent physical damage or death may occur. Suicide, substance abuse, and relationship problems are common among victims of abuse. Victims may become abusers. This concludes our Caregiver Cloud course on abuse and neglect offenders.